Yo, 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 V949 WATV. Welcome to the show. Happy Sunday to each of you, all of you, everywhere. Let me get this muted so that you won't hear that feedback. Okay, perfect. So, boom to the doom. All right, so everybody, welcome in to the show. It is the second Sunday of the month, and on the second Sundays, it is all about what's hot in health with our girls, our favorite pharmacists from Meds Plus Consulting. So that's what we're doing today. Welcome to the show. Get ready with those health questions if you have any, and I think more so about prescription um what do you call it, updates or whatever's happening, what's hot in health. That's what it is. Hey Courtney, hey Victor, everybody else, come on in here. We got room for you to join the show. Let's start with Eddie. How's your week been?
My week has been pretty cool. It was chill. Like first week back off vacation, getting back into the swing of things. Came from Los Angeles,
Yeah, we saw you.
but just running it up now, getting everybody back on schedule. So
Okay,
pretty good week, productive.
awesome. Okay, what to do, J Hat?
Hey, what's up, Birmingham?
Hi.
Great week, great week. Back to school we go.
I know, right?
A lot to talk about there, but overall, great week, man.
Cool. Okay. Wednesday.
Oh, it's my turn.
Oh yeah.
So,
Yeah.
this week has been very, very busy. Of course, a lot of productive things being done with the business. Started a new business venture, which is
Awesome.
going very, very well, might I say myself.
Okay.
And I'm getting my son ready to go to college. So I'm fixing to experience the whole empty nester
Yes.
being my age at this very young age.
You excited?
I'm very excited.
Better
But
have some
not
parties.
No, ma'am.
Watch.
Okay.
All right then. And Marshall, our intern.
Hi. My
Hey.
week was okay. Just trying to have a better week than last week.
I know,
honestly.
right?
Yeah.
And I'm with you on that.
Yeah.
I'm with you on that. So we pray that your week is the best that it can be this coming week. This kicks it all off. And as for me, I'm just out here trying to get it. I can't even tell you what, when, who, will, why, how. It just was what it was, made it through it, and about to do it again. Praying that this one makes more sense. Um, on the second, I mean, this is what I keep saying. It's the second Sunday. Second Sunday is What's Hot in Health with Meds Plus. Dr. Pauline is on the way. Dr. Jennifer is in the building. How was your week?
Thank you for asking, Lady Wu. My week, I would say, was a roller coaster.
Okay. You
We
sound about
had
right.
an emergency in our building, and we ended on a high note. So
Okay.
it all
Okay.
leveled out.
Cool. And I think it always does. Like for the most part, it levels out. Everything is gonna be what it's gonna be. So Jay, had you want to talk about the first week of school. Like yeah. So how was that for you? Because you're the only one that's in there. We don't go there.
I would love to hear about the cell phone thing.
Oh man,
That's all I want to know about.
I was gonna propose off air that we bring in the baby and let them talk about that mental health with it.
Yeah.
But oh man, it was beautiful. But it was first day was kind of weird.
Because it was a Thursday.
Definitely because it was Thursday, but just seeing their reaction to the policy, they took it overall well for the first day. A lot of mixed emotions. We had some very meaningful discussions. We actually delved into the Focus Act. We looked at HB 166 in both of my AP classes, and hearing from them was beautiful.
Mm-hmm.
They have a lot to share. Some things I never thought about. So I think their voice needs to be heard. But we also talked about the impact this is on their mental health. Just the abrupt cut and how that has put them in a place of isolation. They feel disconnection from their reality. And but overall, man, shout out to the Hill. We did our thing. First 2 days were amazing. Shout out to our principal, Dr. Carolyn Russell Walker, and Nelson for making the first day amazing. So we're
That's
ready
what's
for
up.
this week.
All right.
And then we had Taste the Rams of the Day, which is our open house, and it was power packed as well. So yeah,
I gotta sing your Ramsey on. She ain't doing none of that. They be like, hey man, I'm trying to get up out of here. I ain't coming to none of that. And I'm like, that's cool. Hey, you've done it 3 times.
I went and go grab me some food today, and I
Uh-huh.
talked to a girl that I met that was in high school, and I asked her, how's that cell phone policy thing? And her gripe was, she said, like, juniors and seniors, because they have like free periods, it's so much free time throughout the whole day, even with the classes you take. And she was
Mhm.
like, there's just nothing to do now. Like this, like for me, I've always criticized this as feel good policy because there's no objective outcome of what they made it for. Is like I think they want to blame that on why Alabama been so low in scoring for so long, but it's like
Yeah.
that predates having cell phones in the schools, so you really can't blame it on that. But it's like the schools, there was literally not time for schools to prepare something for that possibility. That what do we have in that spare free time where we know that kids in all ranges be having free periods and free time like that.
Right.
Send them
It would have
outside.
been nice for that to be a part of
That's
the
right.
Send them
discussion.
outside. Just as if they were at home. Send them outside.
More tutoring.
Yeah.
But I mean, see, it's
ACT prep.
it's a lot to do.
Something.
There are a lot of things to do, but I like the idea of what is this to repair. So in the world that we live in, do I want to wait on a robocall when my child can call or text me right quick and say, "Hey, this is happening," or whatever that may be? I do get the other side of it though, as a facilitator and a former instructor. When I'm teaching, like during instruction time, I don't need you watching TikTok videos and texting and playing on your phone, taking pictures or whatever. Not in that time. But there are times when phones should be okay. Like right now in this classroom, this is a no phone zone. But when you go in the hallway, when you go in the lunchroom and the bathroom, like what?
I
What?
think the lunchroom and the bathroom are where they're using it to record fights and uploading things.
Okay. I'm still about to fight.
But I think that I think that more than anything gives teachers information to know who to get in trouble, because now it's just no metric now. So they're just gonna be finding the bathroom, no nobody know.
Well, that's what we used
Right.
to
I know what I'm saying
Yeah.
is,
do. You know?
but now if there are people who, because I done met kids that drag people who ain't got no business to be in fights in the fight because they just like to fight.
Yeah.
So what I'm
That's the same
saying,
thing that
them
happens.
recording is fine. I'm inclined to believe that it's more so any of these RSOs that's been manhandling the kids. It's like we don't want these kind of recordings to be able to be accessed by kids if that's the case.
If you jacking up a kid is recording. School resource officers, for those who may not know what an SRO is. J Hat. So you're in the school, and I guess you read the new whatever law, commandment, legislation, whatever it is. What was the purpose?
It's not just the phones, right? It
Okay.
is based on the learning curve. And to your point, Eddie, I'll bring this up. Birmingham City Schools was placed in the top 10 in several categories this year. We made number one in largest strides in mathematics this year. Our children are reading on grade level, but just the act itself, it was also a internet policy, right? To save the internet, and that's to target the bullying, the trafficking, and those sort of things. The rollout wasn't supposed to happen to next year, but Birmingham City already had a policy in place that was pretty much already. It just wanted to enforce at a high degree. With the phones, I have seen engagement like never before. I have seen teaching and learning happening. The hallways were quiet, and when you walked in classrooms, man, you saw next level teaching and learning. And so I think um, as it goes on, you give them a little while, they're going to get used to it, and I think that the target of the goal will be met. The
Okay.
objective is to increase social learning, and they even admitted, that they're sitting in the lunchroom, kind of looking at each other. And I said, "Hey, that's going to go away. You're going to not sit there forever. You're going to engage. You're going to meet new people, whatever." I said, "We didn't have these things. We came out all right." Yeah, but that was so long ago. So I do get it.
Y'all didn't
And
even
they do have a
color
point.
around. It
Like
was
we
black
we
and
can't
white.
we can't make it seem like they don't have a point. Was ages ago,
Yeah.
and the world changed post COVID. Everything they have done has been technologically driven.
Right.
We spent
Yes.
money to incorporate technology in the classroom. Shoot, we even sent out QR codes from the district and saying, "Hey, we need you to scan this survey. We need you to do this." And a lot of these things they brought out. But for the people that are juniors and seniors, those who have jobs,
Mm-hmm.
and I think that's why I was going to hit you guys with it. They have some very different takes. Like two or three students was like, "Hey, I miss money because my job was trying to get me to come in at the end of the workday."
Yeah.
And it's like, well, everybody's unique circumstances are different, but some of these kids need to work. Some of these kids needs to work. And,
Absolutely.
it's a different element, but hey, overall, I'm excited about it because I think the overall goal of learning at a high level will make it do what it do.
Okay.
I think Eddie had a good point. I think this is an awesome opportunity to do a clinical trial, to do a study
Yeah.
for outcomes as it relates to mental health.
Mhm.
What's the baseline? What are the improvements? Also, from a health aspect as well, with being overstimulated throughout the day just by scrolling on social media. So not only do we have the social aspect, but the health aspect as well.
Yeah.
And one of the things that I wanted to talk about today was Dr. Pauline and I, we had an opportunity, we spoke about wellness at the Birmingham Promise Institute at Innovation Depot a couple of weekends ago.
Mhm.
We were just merely measuring blood pressure of high school graduates about to go to college. I had a few that I had to follow up with high blood pressure. And when I say high,
Mhm.
I mean high blood pressure, like stage 1, possibly stage 2.
Wow.
So we're doing a lot of things on our phones. There's a lot of misinformation. So I would just be curious if someone out there is going to do a study, Eddie, on what are the improvements of not having ready access to the cell phone for a good chunk of their day.
Yeah.
Well, I mean, I think you have to calculate how much you can realistically even scroll in a day and perform. Jay had said that like we done made some top tens while the cell phone policy was still implemented.
Okay.
So what was different then that got that top 10 going? And what baseline we create of what changes then? I'm just not a fan of when I'm just not a fan of the older generation when they didn't have something measuring what the new generation shouldn't have because they did something without it, without calculating that the world is different. And I'm not saying that it can't be. I'm just saying there has not been a baseline metric put down of this is what we're looking for. This is what will increase over the next year because of this. And also, none of this will save children from cell phones because if they can doom scroll after they get out of school for 4 hours, that's longer than they would doom scroll at home. They can still cyberbully after school. I mean, they might not have the video because they don't have to
Yeah,
record at school.
I
So
just
it's
save
like
it till I get home.
there's more to zoom into on these conversations.
So the only thing that I would say about this whole, if it's an experiment or whatever, um, you can't expect to ask for something to change socially with our children without trying something with them first and foremost. You can't ask for something to change socially and with their interactions as a whole and having kids to engage more in school and in class. You complain about one aspect and then when there's a change put in forth, um, from the older generation because they see what's worked before. What's worked before is that you have more interaction in the classroom because there were no cell phones in the classrooms and in the schools. And you can't say, well, these kids, they don't go outside and play. They don't know
Mhm.
how to have conversations with each other. You take away the phones, more conversations will be had. It might take time, but something has to change at some point. And so when people make changes in systems, you can't criticize the change without really seeing if it works or not
That's
before
called
you criticize it.
evaluation.
Yes.
And there's nothing to
Yeah.
evaluate because they just
That's why
they're just doing
There
they
it.
just
is
did
something. No, so there's a catalyst for change, right? You have to have a catalyst. The catalyst for the change was these kids do not know how to interact. So you have to put something in forth to make the change. Let's take these cell phones away. What's been very what's made kids not interact with each other? They're always in the phone. They have their face down in their phones every day, all day. If they want to doom scroll after school, let them doom scroll after school. But let's take care of what's important first. Your education should be first, foremost. So get in these classrooms, take these phones away from these kids, let them interact with their. A lot of kids didn't even know what the teacher name was.
I don't me either.
So, I mean, but you have to do something in order to try to change the narrative for these kids.
Okay.
And if it don't work, it don't work. But let's say we did try to make something work.
Should phones be allowed in schools? It's the question right now. And we have Mets Plus in the building that have brought us some information that we should get into and see what's popping in health. I know that human services, they still making noise, and y'all know that's what I'm in school for. So I want to hear what's hot in health so I can see if I need to change this program again. Um, shoot now. Yeah. Stefan said test scores, higher test scores equal more money through the ACAP. So we can make them, if we can get the students more focused on this test taking and we can get higher test scores, more money will be made.
Made to be put into the school system.
Yeah.
Okay, well that would
That makes sense. All right. More money is always a catalyst. So yeah, that's something to think about. Should phones be allowed in schools? I'm gonna say that in moderation, yes. And it's because of the world that we live in and the things that are happening. So my only question for you, J Hat, is what are they being put in during the day?
Right now, our policy is they're going to put them in their bags and in their lockers.
Okay, that's cool. Don't be taking my phone, zipping it up in no bag like I'm in a concert. Because I saw that too, and I was like, that's a little excessive.
And the way the law reads, it gave the local boards autonomy on how to handle it. Some schools are doing the pouches, some schools are taking them up in first. So, I think overall, the parents will probably be the biggest challenge about this.
Yeah,
to be honest, because I remember when the cell phones actually became popular. I'm sure everybody else.
I was
it was right after the
and I got
Sandy
the little
Hook
snake phone.
after the
snake
school
game
shooting.
was on my phone.
Yeah, at the elementary
in the
school. So
room.
they've had them for a long time for that very purpose. Yeah. But it got to be abuse. Parents calling during the middle of the day, texting.
I was just about to say, but the people that I talk to on my phone are here with me, so I ain't just on my phone. We didn't have TikTok, Facebook. We didn't have any of that yet. We had each other, and our phones were for like playing the game on and emergencies. That's kind of how it started. But we have evolved. So, hey. All right. Meds Plus. Hey. Welcome back every second Sunday to the show. Last month, it was about perimenopause. Baby, everybody was in on that. They were really into that conversation.
Fanning.
Yeah. Yes. With them fans, it was all of that. And that's, like I said, that's still what I've been seeing. And I've been seeing some correlations with perimenopause and ADHD. I've been, so whatever it is that's relevant to you is what you see in your algorithm. That's what I've been seeing. What is hot in health?
Well, we can kind of stay on that topic of back to school. So as we know, anytime back to school comes around, the topic of vaccinations comes up. Because then soon after, now we are in immunization season. August is immunization month.
Okay.
So right now, flu vaccines, they're all good to go. Now, there is some other information, new information on the COVID vaccine.
What, like anti-vaxxers or?
Not necessarily anti-vaxxers. So just taking a look at, who should be eligible for COVID vaccines. The decision has been made that people under the age of 65, or if you're not immune compromised, that you could possibly forego the updated COVID vaccine that's going to come out in a couple of weeks. And so that is what's hot in health. That's new in health. Traditionally, when you're over the age of 65, or if you have some type of if you're immune compromised, you're at increased risk of complications from, contracting COVID and whatnot. So they're recommending that if you're under the age of 65, just talk to your healthcare professional. Of course, people can always call us if they have questions, just to see if you are eligible or if you should receive an updated COVID vaccine.
Okay. What's up?
I don't want to. I want to ask, but I don't want to.
They thinking it.
Yeah.
Okay, so can you? I know what's been in my algorithm when it comes to this season and people getting sick. They posted a list of the side effects or the complications from the first COVID vaccination, and I just wanted to know if you guys could address or debunk what they're saying the first COVID vaccination caused in people today. Because a lot of people are afraid now of actually getting the vaccination due to what's happening with a lot of patients, especially what I've seen, like with my patients in the hospital. It's just, can y'all address that list?
Yeah, so that's actually not in my algorithm. So, I mean, other than like cardiomyopathy, which we know has been one of the main side effects that people talk about, and that's just an inflammation of the heart muscle. for primarily young men is where that side effect came from. And so, there's been a caution on it from maybe 2022, early 23 to use with caution in young men because of that risk. But what other side effects or ill effects are people kind of referring to?
Well, there was a list published by a doctor, and he was letting people know about the risk of forming blood clots, the cardiomyopathy, having heart attacks, strokes. It was just a lot of heart related and blood vessel related conditions that were, they said that the COVID vaccination had been causing in people. And I mean, I've seen an increase in it, like younger men, as you say, especially high school age. These guys are going into cardiac arrest. And it could be due to other supplements that they're taking, because a lot of these guys are in the gym and they're taking a lot of caffeine. They're taking a lot of pre-workouts now because it's a craze with pre-workouts. That, along with the vaccination, I think it does not make it better. My son's best friend, 17, he tore his subclavian artery and passed away in his sleep. So you have to, I just want people to be more educated.
Yeah, I definitely agree with additional education. What I caution people of is going to direct correlation. So we know that, just because there seems to be an increased risk of heart attack, different type of effects, they have not established a direct correlation. And so I would urge people to talk to your healthcare providers, make sure that, again, other lifestyle factors don't put you at risk. We also see an increased risk or increased incidence of things like vaping. Again, we talked about the supplements and pre-workouts and things that people are using that we don't know, what the combination of that with vaccines may cause. That hasn't been studied specifically. So I just caution people not to think of that there's a direct correlation between the COVID vaccine and a young person having a heart attack. I remember being in school and a young football player, had a cardiac issue. And this was 30 years ago on the field, and it's happening. But I haven't seen any evidence that it's happening more frequently than in the past.
I remember sickle cell trait being something that caused that type of type of response with athletes, and my mama making sure that they knew she has the trait, and when she says that she needs to sit, she needs to have water. We don't want kidney injuries. We don't want any of these other things. And I experienced that with my daughter this past year. So there are so many different things that could cause these issues, but are people really getting the COVID shot? Do they want it anyway? Younger people, do they want it?
Yeah, I would say, it's definitely declined since the first two, the original doses where you had to get the 2 doses a couple of weeks apart. The incidence of people receiving the vaccine has declined. And that's really a good thing because, you have to think about it. 2020, 2021, our bodies didn't know what to do with COVID. That's why everybody went into this hyper-inflammatory response. They were having to be hospitalized because our immune systems hadn't seen that particular virus before. Well, now, because of herd immunity and because of people getting vaccines, our bodies know what to do. And because of that, it's less likely that someone who is, that somebody who's in good health, maybe in their mid 30s, 40s, 50s, with no comorbid health conditions, they will get the virus and recover.
Okay.
Where, back in 2020, we didn't know. We couldn't identify, who's going to have a severe reaction to the virus and who's not. So I think it's a good thing that we're not seeing this affecting us as harshly.
Okay.
Another thing I want to add is like there, and we see this with RFK now, whether we're talking about autism or we're talking about COVID, there is no shortage of anti-vaxxers who are committed to anti-vax problems to the degree that they will call everything after somebody has taken a vaccine a cause of the vaccine. When there are so many more issues in the human condition that show up for reasons that will be unrelated to that, but they correlate it. And like, again, there are people that come up with lists. They're not because he finding people to put on these boards that are anti-research. They cut $500 million from the mRNA research right now. So just do your Googles, do your research. When you see lists like that, like look up what fine. Just do your due diligence for that.
Not only did he take the money away, there's an advisory council that makes recommendations for immunizations every year. He fired all of them.
Oh my goodness.
And we rely on that recommendation because, in turn, the insurance company decides what vaccines they will cover based on the recommendations. We're pretty sure they're going to cover the COVID vaccine. I'm sorry, the flu vaccine. We're not so sure about the others at this point right now. More than likely, they will. So we really have to stay in tune with what's going on so that we can know when the vaccines become available. We need to be first in line. We need to make sure that we're going to be able to get that. It's not until something is taken away that we realize the importance of it, and we don't want to be in that situation either. I want to go back to the comorbidity piece because I'm going to go back to what we said when we were taking teenagers, young adults, blood pressure. Most of the time, once they leave home and they go off to college, they may or may not have their yearly or annual checkup. So now this blood pressure is being unchecked. So now they're still drinking the Monsters, the Red Bulls, the energy drinks, staying up late, eating pizza, vaping, doing other things that they haven't done before. So now we're adding to the risk of other things that are happening or laying a foundation for a poor outcome if something else is added on top of that, like another illness or something.
Yeah.
So I think we have to be wise to understand it's our responsibility to make sure our baseline health is where it needs to be. And that starts with prevention. And that starts with that annual checkup. That starts with the screenings. That starts with asking our family members, is there a history of high blood pressure, diabetes, cancer, whatever that risk is? What did grandma and grandpa, auntie, uncle, cousin, what did those people die from? And make sure that your primary care doctor knows that. That's going to make a difference in what you're recommended to do next. So that's the important part is the baseline. That's why we had so many deaths when COVID came.
Yeah, because of all the underlying things.
Underlying illnesses.
Woo. All right. So if you are, whatever it is, you all are basically telling me that coming soon, 65 and older will get it. And the rest of us need to just, what?
Yeah, it's called shared decision making. So you want to get with your healthcare provider, whether it's your physician, nurse practitioner, pharmacist, and just talk about your risk of severe disease. And if you have an increased risk of severe disease, it is recommended that you get the vaccine. So you want to make that decision with your healthcare provider.
Okay, and severe disease meaning?
Meaning you have to be hospitalized or you have the potential to die from contracting COVID.
Ooh.
Most people who don't have those comorbid conditions like hypertension, heart disease, respiratory disease, may not be as, those people who have those diseases are at increased risk, where those who don't are not. So you just want to discuss your risk for severe disease.
Okay. All
right. Taking medication for a chronic disease.
Okay. So chronic diseases, and people don't even know what chronic is compared to acute. We don't really know that.
Yeah, so I mean, it's kind of easy. When we talk about acute disease, we talk about something that either will go away on its own, or if you take a round of medication, say an antibiotic for a bacterial infection, that's an acute disease. When we talk about chronic disease, it's something that lasts for over a year, something that you have to take medication for daily, such as hypertension, diabetes, heart disease, those type of things. So that's the difference between acute and chronic disease. Chronic is with you long term. Acute is a short term illness.
Gotcha. All right. Eddie and I were trying to see what we thought was hot in health, because we always wait to see what you guys are going to bring, and we both thought about the same thing. If you get food stamps, they don't want you buying candy no more.
I heard that. And I actually talked to somebody who was very upset about that. She was like, they can't tell me what to spend with my money. And I'm like,
right. When I used to get stamps, that's when I would try things that I wouldn't normally buy. Like, you know what? They cost how much? Let me get 2 of them.
Because it ain't coming out of my money.
Yeah, let me try that. Now, nope.
You gotta buy fruits and vegetables.
I don't.
But this is the issue is in food deserts. The food, there's too many food deserts when you start going out to Stare It and when you start getting out in the Vincent, like they're literally a gas station at Dollar General that don't have bananas or oranges. It's like, so it's like, it's just things have been taken away.
Stuff
I mean, I ain't saying, I mean, candy bar and chips suck, but there are protein type bars that will be called candy bars, and there are, you know, chips that give more fiber. Like, so it's, the definitions are lacking. It's like, what are they doing? And that's what I was meaning in the earlier conversation. They're not creating baselines.
Don't swipe that card for some Skittles.
I'm hungry.
That ain't food. So I think they mean what they mean.
They said what they said.
Yeah, they said what they
You know
said.
what? I mean, I think, you know, one of the things that we talk about is of course, nutrition and just having good nutrition so that our bodies can do what God intended them to do. So Eddie brings up a great point regarding food deserts. If you know, don't have access to healthy food within 10, 15, 20 miles of your home, you have to eat what you can. So I feel like, you know, and I heard y'all talking about the cell phone policy on the way in. When you create a rule or a law without thinking about everybody that it will affect, I feel like you're being very short-sighted. And so we have the thing where, you know, some people, their restaurant is the fried chicken at the gas station. And so they go in and they get that, and they may get, you know, some carrots or whatever else they have, but that's all they have access to. And so without giving them another route, without giving them a way to get fresh fruits and vegetables, I feel like you're causing an issue where these people may go hungry because they don't have access to other foods.
You're right. Let me read some of what the government is saying. Some states are restricting the use of SNAP benefits, formerly known as food stamps, to purchase candy and soda, with a focus on promoting healthier eating habits. This is being implemented through waivers granted by the USDA to states, allowing them to ban the use of SNAP funds for certain unhealthy items. A more detailed explanation is that waivers and restrictions, the USDA has approved waivers for several states, including Arkansas, Idaho, and Utah, allowing them to restrict the purchase of items like soda and candy with SNAP benefits. Let's see. Some fear that these restrictions are a step toward further cuts or even the elimination of SNAP benefits. Examples of restriction, well, in Alabama, a state senator is proposing a bill to ban the purchase of soda and candy with SNAP benefits. This is partly driven by the state potentially having to pay a larger share of SNAP costs in the future and the goal of improving public health. A total of 12 states have now adopted the USDA waivers that restrict SNAP purchases, including the 6 new states approved recently. Okay. Soda and candy.
I mean, is that really just a big difference? You can't buy soda, you can't buy candy with SNAP benefits. It's government benefits.
And I think another
Buy
question.
water.
Another question too that I don't know the answer to, maybe y'all do, is, you know, in homes that receive SNAP benefits, what percentage of their food purchases for the month is made by SNAP benefits versus, you know, supplemental income,
Absolutely.
them buying their own groceries.
Right.
So could they buy fruits, vegetables, you know, what they have access to, the healthy food with the SNAP benefits, and then get their Skittles and soda with their own money?
Yeah.
I mean, I think that's an interesting question to kind of ponder. What percentage of their monthly food budget goes toward or is put on their SNAP benefit card? Or are there people that have supplemental income?
My problem is the baseline. Like, Alabama did not go look at every SNAP recipient's receipt to see if a parent, I mean, are parents buying 50 Hershey balls every week?
I mean, if I'm gonna send them to the school so she can sell them, yeah.
But I mean,
that's none of your business.
Ain't number 5 people in the school can do that for real. Everybody can't have. Otherwise, everybody just got Hershey balls. You know what I'm saying?
Yeah.
That's my only thing with all of this legislation. It comes off to be feel good legislation because you do things that look like it feels good. But like, if nobody is really just buying any more Hershey bars or chips than anybody else is, because parents are trying to be somewhat responsible in the middle of a food desert, they still trying to buy the best options they got, then what is the change based off of? To me, it's based off of we hate poor people.
Oh,
everything the government is doing is we hate poor people.
I'm gonna put a pin in that because if they hate them, let's see what Kennedy said. He said for years SNAP has used taxpayer dollars to fund soda and candy. Those things in particular.
And everything
Stop
else.
calling it soda. It's drink. Anyway.
It's drink.
It's drink. Yes. Now stop. He said that first, and he was like, "Those products fuel America's diabetes and chronic disease epidemics," which you just talked about. I ain't ever got no asthma off of Dr. Pepper. These waivers help put real food back at the center of the program and empower states to lead the charge in protecting public health. It does sound good. It sounds accurate, right?
It is accurate.
Not to me.
But it's kind of who gets SNAP benefits. What's hot in health?
People who make Kool-Aid and put tons of sugar in
You
it.
sound just as racist as them.
That's not racism. That's just facts.
Who makes Kool-Aid?
What is the biggest drug on the market? Sugar.
I don't like
what
sugar
causes
like that.
the most disease on the market?
Sugar.
So do you want help?
No.
And
I want you to
and
help
the
me buy
biggest
these
problem,
groceries.
I think the biggest problem with the health industry being the health industry is that when people tell you what to do in order to be healthier, you resist it.
Absolutely.
Yeah, because I didn't ask you. Give me my.
Well,
food
no, we
stamps.
want people to co-sign what we think.
Yeah.
We want people to
Yeah.
co-sign
We want
our
things to
mindset.
work.
Absolutely.
So
Absolutely.
even if it sounds like a hate crime on poor people, we want poor people to be healthy too. Don't say you want help. Don't say you want to be, y'all not considering us. Okay, well, we just want you to continue to die. Buy all the soda and sugar you like.
Do they really
and
care?
still fund big pharma. Because the more you have diabetes, the more you have heart disease, guess what? The more we make money.
And we
So-
want to make that. So that's the thing. Like outside of the, this what we're reading, when we start having these vital conversations about it, it does get into the full loop of it all, right?
And you have to look at the big picture. You can't just look at one side of it and say, "Oh, I think they're doing things just to feel good." Okay, well, stop complaining about big pharma producing drugs just so they can make money and keep people sick. When they say and make laws and legislation that say, "Hey, we don't want you to be sick," well, stop using this money to buy this type of food. There's so many other things to eat.
Well,
even if it is food desert. Okay,
I think if
bye.
somebody else was saying it, we would take it better.
Right,
Robert
we
F.
would
Kennedy
take- if
got
Jesse
worms in his
Jackson
brain.
said it, if Jesse
we'll do
Jackson
it.
said it, we'd be like, "Oh, he cares about our health."
Yeah. So he
I
should-
wouldn't.
Yeah.
Jesse Jackson
I
still
mean,
the
but
elite.
there,
He's
there
still the
are
government.
always
So there
going
we
to
go.
be people who are dedicated to
But-
not understanding.
Okay, so that's one
You
side.
know,
The other
so-
side of what I'm hearing too, I hear what you're saying, Wendy, on the health side, and what you all are here for what's hot in health. But then Eddie, on the social side, these are some rich folk talking about candy and drink.
But to me, the solution is at the corporations. If you go to Mexico, Mexican Coke, Mexican Doritos, Mexican Cheetos do not taste like they taste over
It'd
here.
be flat.
Like
Mhm.
RFK them, if they really want change, they're going to have to go to these corporations and start monitoring how much of this stuff they put in there. Because, okay, ban chips, ban candy bars, but that ain't going to stop Big Mama from making another pound cake for the family. So it ain't about zooming into actual helping, because if that was the case, we will create food deserts while we're taking these options away.
You know what? You know what the big thing is, though? Anytime you don't do things for yourself, you allow people to have control over what you do. So I think one of the things they're trying to do is push people off of these benefits, and
For
it gives
sure.
people the initiative to say, "Hey, I don't want you controlling what I buy. So let me make enough money to buy what I want to buy. Let me put myself in a better situation so I don't have to be on something where somebody's telling me where I can spend my money." I think that's another part of it. That's just a part of the big picture. But while you're on government assisted benefits, we have to regulate them. They come with rules and regulations. You just don't get to take from the government or get things from the government and say, "Hey, I'm going to do what I want to do with it." If you want to do what you want to do with something, just like they tell you, when you get grown, get out my house. You be able to do what you want to do. But while you in my house, you're going to follow my rules.
To me, though, it has to make sense.
It does.
It
make
don't have
sense.
to, because it's the government. They the elites. They can
Yeah,
make whatever decision they
can do
want
what
to.
they wanna do.
But I'm saying, amongst the people that I live amongst, they making decisions that don't have any basis of anything other than wagging your finger at you the cause of your issue. When sometimes they are, but it's like there is a family who don't eat sweets like that, who they autonomy of how they purchase stuff is being stripped away. There's a family who buy a candy bar a month or a candy bar as a treat. They can't do that
Right,
But they can
right.
afford 50 cents
No,
a month.
Well,
no.
You see what I'm saying?
Go
Like,
ahead.
if you are only buying these things one time a month, it won't matter if you can buy with SNAP benefits or not, because I'm pretty sure you pick up 50 cents off the ground, somebody done dropped in them
But that's-
and get you a candy
But you
bar.
have that luxury of thought because of where
Mm.
you grew up
I
at.
don't have the luxury of
What I'm
thought.
saying is I know that I could go across my mama house and my grandmama house when I was little and find some quarters. There are families that can't do that. 50 cents is hard for some people.
I
It's
ain't
not
lying,
that
'cause
simple.
I've been trying to roll some quarters together all day and can't find nothing. Let's go to the phone lines right quick and see if they have something pertaining to this topic. Caller, you're in with the show. What's hot in
Hey,
health?
look, Lady Roo.
Hey, baby, how are you?
I'm good.
Good. Good to hear from you. 9948949. Jump in and share on what's hot in health. What's hot in health tonight, right now. Meds Plus is in the building. I love my callers, I do. But let's stay on
Again,
task.
and I want to be clear about what I'm saying.
Yeah.
I'm not against any changes. I just want to know what the change is coming from.
Yeah.
If there is more diabetes in this community, I need them to say we want to see less diabetes in the community. These are the measures that there are now. Let's reduce that. Or when we checked all these receipts, they buying this many percent of candy bars with their stuff. Let's have them buy this much. They're not creating any metric to change from. With the cell phone policy, where is that? They just saying we don't like how y'all moving, so let's do something different. But you got to have a metric to how that change happens.
And when you really look at how research happens, it does, like when it did say there are catalysts for change, or for the somebody's looking for some reason, if it's to pad more pockets or whatever it is, people are looking for what they're looking for. But when you make things that affect me, I do want to nothing about me without me. Period.
You know the conversation we had the other night at the hospital when I was at work. There's a shortage with people that actually need those diabetic medications. Why all y'all need diabetic medications?
Because we want to lose weight, Wendy.
Okay, most of y'all that's on these diabetic medications, and I'm talking about the shots. I'm not talking about like metformin and things like that. I'm talking about Ozempic, Wegovy, Mounjaro, things like that. There's a shortage. It's a lot of people buying this stuff. So guess what? Okay, we're going to fix this. Don't buy no more sugar. Don't buy no more sweets. It's like some things go without having to be said out loud.
But to me, that's a problem if the reason that there's a shortage is because privileged people are buying it all up because
it ain't the privileged people. It's the people that's next door to you.
That's true. But I do want to say that, regarding the use of like weight loss medications, and I think we've said this here on the show before, we realize that obesity is a chronic disease like diabetes, like hypertension. And so with that being said, at this point, there's a separation of the diabetes medication from the obesity medication. So if you are treating obesity, you'll be taking Wegovy and Zepbound. If you have diabetes, you'll be taking Mounjaro and Ozempic. But I think we need to recognize that obesity is a chronic disease, that sugar is more addictive than cocaine and marijuana. And so we should not come from the position either of saying, okay, we're just going to cut you off. You can't have it. You cannot buy Hershey bars anymore. I feel like that's not necessarily the right direction either, but you have to be able to provide education and empowerment for you to be able to say, listen, we want you to improve your health, to your point, Eddie, because we know that, 14% of Alabamians have diabetes, which is one of the highest in the nation. What can we do to bring that number down? Even more people than that have pre-diabetes, and those people don't even know it. So they're headed toward diabetes, and the age is getting younger and younger. So what can we do as a community to say we want to take control of our health and not let it come from the government? Everything should not be led from the government. We have to, envelop our own community and try to improve the health that way.
All right. 9948949. What's hot in health? Meds Plus Consulting is in the building. Our favorite pharmacist, keeping it G with us about what they see and what's happening from their professional lens as far as medicine and advancements and changes, legislation, and how that impacts the consumers, who are us, the people that are getting the prescriptions. So when you think about what's being said, both of the main topics we've discussed are, some people are saying population control type things. Like, look, we trying to control the pop, and we're tired of paying for you to do these things or covering this for you and sending you this. Planned Parenthood said that they didn't even get the condoms that they normally get because they, we're not doing that. What does that look like? Like when you talk about what's hot in health and how people are impacted on a daily basis, bigger picture, what does that really look like to us as a future in America with health and well-being? What does that look like?
I think what it looks like, we talked about this before too, that we're headed toward precision medicine, where we're going to be able to fight diseases using information from your specific DNA. It's happening in cancer, it's happening in cardiovascular health, and we don't want to be left behind. So, Jennifer and I have a part of our business model is genomic testing or genetic testing, where we look at it and make sure that, or we check to see how your DNA is affecting your response to certain medications or your response to nutrition. And when we talk about that during our community events, people are literally like, we're speaking another language. Like, what? What are you going to do with my DNA? And it's funny because we when we have our strategy sessions, we're saying, a lot of us have done 23andMe, and just to figure out where we come from on the globe, where our people are from, and they had no problem doing a 23andMe. But when you talk about looking at your DNA to help improve your health outcomes, people are afraid of it. What are you going to do with it? Why do you want to do this? So I just want people to just kind of open your mind to the fact that we're headed toward, personalized medicine. And if we don't get in the game now, we're going to be left behind.
Ooh, okay. Let's go to the phone lines. We got a couple of callers. Caller, you're in with the show. What's your quick question or comment?
Yeah, well, I have a question. I'm in my 70s. Well, good evening to all of you.
Good evening.
Yeah, I'm in my 70s, and I have several friends who have had strokes. I know you haven't said anything about strokes. These are, strokes that have disabled them. Some in the 40s have had strokes. So, give me some information on that as to why you think so many people are having strokes now.
Thank you for calling, and we'll get you on. Let's go ahead and answer that question.
Great question. So that goes back to baseline health. And that goes back to, if you have a chronic condition, are you managing it well? So let's just start with blood pressure. Blood pressure is one of those things that a lot of people try to manage based on how they feel, which is the absolutely wrong or incorrect way to manage. The best way for African American to manage their blood sugar, blood pressure, is to decrease their salt intake. So there we go back to the conversation about chips, processed foods, anything that can be kept on the shelf for longer than a week, and buying those types of foods. We need to manage our salt intake. So that means reading the nutrition label, looking for the amount of sodium that's in it. Also, having a blood pressure monitor at home. Your blood pressure can be high and you have no symptoms. That's why it's called the silent killer. So managing and monitoring your blood pressure is what's going to help you not to have a stroke. And that's why we're seeing it more frequently at younger ages, because we're under so much stress. Stress affects our blood pressure. What we eat affects our blood pressure. The lack of not moving as much as we used to affects our blood pressure as well. So then we think about, as we age, now we may have been diagnosed with blood pressure, but are we taking that blood pressure medication every day? Or are we scrolling on social media and seeing what someone else is saying, that you shouldn't take that medicine? And if your doctor's giving you that, you probably don't need to take it, but you're not having a conversation with a healthcare professional. Sometimes we, can get into that information overload and make our own conclusion, which is not the right conclusion. Making sure for chronic condition, you're taking your medication every day, you're going to have a better result than someone else that does not. So a bad result with someone with uncontrolled blood pressure can lead to a stroke, can lead to a heart attack. Sometimes if you're not able to get medical attention right away, we can see death, or we can see those that have a stroke that's more debilitating. So making sure that those around you know that you have high blood pressure. If you start talking funny, your face is drooping, or you lose your train of thought, you need to get to the hospital right away.
We got 2 more callers. I want to try to get them in before the hour ends. Caller, you're in with the show. What's your quick question, comment?
Thank you so much for taking my call. Just wanted to comment. I'm always blessed by the conversation with Med Plus. We really appreciate them and you bringing them to the airwaves, Lady Wu. I'm going to look at seeing about connecting with them for some of their services.
Awesome. Thank you. Thank
We
you.
need to
Thank you.
know of people we can trust. You mentioned earlier about DNA. So thank you.
Indeed. Thank you so much. Thank you for calling in with that. And I'm so happy that we are exposing the listening audience to these sisters who are doing this work in the community. One more call. Caller, you're in with the show. What's your quick question, quick comment?
Hello. First of all, hello, everybody.
Hey, hey. How you doing?
I'm doing well.
What you got?
Since I am time restricted, then I keep this simple. I did want to talk about everybody have a problem with challenging the so-called healthcare system that we have, especially with mRNA vaccines. But let's deal with diabetes. And somebody mentioned about sugar. Sugar is the number one carcinogenic on demand. But sugar is not the only reason why people like this. Sugar.
Fam, I don't know what you called on or in or from, but it was really, really choppy. You got about 2 minutes to call back if you can call back, roll the window up or whatever, and we can get you in. I see some comments as well, and I appreciate you guys too. Let's see what we got over here. Really, really good information, and don't buy the cheap BP monitor. Get the $100 plus one. Stress and foods are what's messing us up. So all of these different things. Like I said, if you all want to call in and get in on this conversation, you can. We are debating, and I'm just saying on the air, if we should go another hour or not. Yeah, y'all let us know, because if you can go to Meds Plus and sit in there and talk all day if you like. Where are you all located?
Yeah, we are actually located in downtown Birmingham. Our address is 215 Richard Arrington Jr. Boulevard North. So we're in the New South Federal Building on Richard Arrington Jr. Boulevard, which is the one-way between 2nd and 3rd Avenue North.
Okay.
And yes, absolutely. Come in and talk to us. If you want a lot of time, you may want to make an appointment. And you can do that by calling 205-650-4636.
Okay. So that's the contact info. What you got, Dr. Jennifer?
No, I was just going to say that we are going to start accepting new type 2 diabetes patients for our upcoming diabetes education class. It will be held in North Birmingham. So if you give us a call, 205-650-4636, to come and get registered for that class, we can give you the information. But we've been really done really well with helping and people really understanding how their body works and what they have to do different if they want to manage their diabetes. This class that we're currently in, we're in holding it in the evening, so we're able to get a lot of the people that work during the day.
Right.
And we start at 5, we end at 7. And I have to tell them, okay, bye-bye, I'm about to go home. They want to just stay and keep talking and sharing and supporting. There was one woman that said she didn't take her medicine every day. So it was the metformin. And she didn't understand how that was important in addition to the other medication that she's taking. But then when we get her monitor and she sees some discrepancies, and then I go back and talk to her about what insulin spike can do and what that means, she understood.
Okay. So
she came back to
the exposure to the information. You need to be exposed to the information. And like my last caller said, from someone that you can trust.
Absolutely. Absolutely.
All right. In studio, any other questions, thoughts, feelings, suggestions? I mean, Eddie, I know you were on this journey. I hadn't heard much about it, and you just went to LA and ate like crazy. How does that impact your numbers?
Well, in LA, we were doing a lot of walking.
Okay.
It's just monitoring my blood glucose as we walk in, making sure that I'm getting steps in for that. Even though I was eating a lot, I was still limiting bread. When I had a biscuit, like my biscuit video, I took a bite, handed it off to my brother. He finished it off. Same thing for desserts. I was taking a bite out of a cookie for the video, handed it off to somebody else. It was like, it's just monitoring how much what something does to me. At this point, I know what a bite of pound cake do. you know, and I know what a slice of pound cake do. And if I want
And
a
tell
slice
us
of
why
pound
you
cake,
know that, Eddie.
why I know that, I got my I got a CGM. It's a continuous glucose monitor. It's basically a patch that you put onto your skin, and it actively monitors your blood glucose by the fluid between your blood cells.
Okay.
And it just tells you what your blood glucose is. It's not accurate, 100% accurate, but when you do it, you take you prick your finger too to see what, you know, how many numbers it's off, so it kind of give you that. And it don't completely eliminate pricking your finger, but when I eat, it shows how much my blood glucose goes up and how quickly it goes down. How quickly it goes down if I go for a walk after I eat. All of these things, it's just collecting data to know how I can consume what I can consume.
And you all can learn this information from Meds Plus Consulting because they specialize in conversations about and work on diabetes. The last show that we had, I had some callers that were asking about the classes. So I'm really happy when I hear people finding a resource. When it comes to your health and healthcare management, you need to have reliable resources and people that you can trust and believe when they say things and don't feel like they're just trying to give you something because they're getting paid, they're getting kickbacks out of a study or something. No, I need you to be taking care of me.
Let me also add that, like, the one that I have is over the counter. It's a Dexcom Stilo, and other ones have over the counter ones, but the one I have is a Dexcom, where if you just want to see what food does to your blood glucose, and or you want to keep up with your thing to make sure that you don't get to 426 like I did, you know, having one in the chamber to use for 15 days every 3 or 4 months, I think it would just be, it was an exciting part of the journey to be seeing what food actually does in your body while you're using it and what working out and stuff does as well.
All right, ladies, again, give them your contact information.
So we can be reached by phone at 205-650-4636. You can email us at info@medsplusconsulting.com or visit our website, medsplusconsulting.com, or just follow us on all of our social media at medsplusconsulting.com. That's MEDSPLUS consulting.com. Tune in Monday at 1 o'clock where we have our Meds Plus Medical Minute Live with more health topics.
I love it. And that's why you're here, because you're vital. Every second Sunday is What's Hot in Health with Meds Plus Consulting right here on the show. We'll be back next Sunday if we feel like it. Y'all be vital. Have a great week. Bye-bye.
I love how you say you feel like.